Are you suffering from weak core and you're absolute beginners and you need to slowly engage without downward pressure in your pelvic floor? If you have diastasis recti, prevent overstretching of your linea alba, which is a gap if you're postpartum, perimenopausal, menopausal women with leaky, latchkey bladder, which means when you laugh, sneeze, and cough, you have a leak or you have that urgency. It's important to strengthen our core muscles, but safely and effectively without the downward pressure in your pelvic floor or the canister motion of our pelvic floor and diaphragm that dances together. At the same time, it also helps build strength without the holding breath. So when you're holding breath, it's important that you don't do that. Evidence-based science, when you're breath holding, it creates more downward pressure towards your pelvic floor. And that's why it's important to slowly build it up step by step. And you can join me on my upcoming free 6-day signature series using Circuit. Circuit is a lovely workout tool to help engage your core safely and effectively using science, physical therapy, therapeutic exercises, and neuromuscular re-education to slowly engage your weak core. So if you've been pregnant for 9 months and you want to start going back to the gym, it's best to slowly build it up. Focus on your core, your pelvic floor, as long as you have a clearance from your doctor. So this is one of the tools of Circuit, and they also have elastic bands and stretchy bands and rods you can use to slowly build strength. I love this product because it's gentle, it's easy to use, and you can carry it anywhere you go when you're traveling, as well as when you're home. You don't need a lot of equipment to slowly build your core strength and your whole body safely and effectively. So today, in day 1, we are going to start proper breath work using the Circuit. So of course, you want to start lying on your back, placing your hands on your abdomen and your chest. You want to make sure you're doing the breath properly. So before we use the Circuit, I want to make sure you are engaging your core. So one hand on your abdomen and one on your chest muscles. So as you inhale, most patients with pelvic floor issue, they breathe through their chest. And when you lift your chest up, instead of having the diaphragm really stretch out down and the pelvic floor to engage, you ended up downward pressure as you exhale. So this is how we do proper diaphragmatic breathing. You inhale through your nose and expand your abdominal muscles without moving your chest. As you do that, your pelvic floor starts engaging in an eccentric lengthening. Gently stretch it out. As you exhale, you slowly breathe out through your mouth, which is very essential to engage your core. And as you breathe out through your mouth, you want to make sure your brow is in a pursed lip position. And slowly tightening your lower abs. All the way from your lower abs, zip it up from your lower abs to your navel and up. You can use your hand and fingers to visualize that lifting. So when you do that, as you exhale, you gently lift your pelvic floor in a concentric position as you exhale. Inhale, expand. Exhale, zip it up. And the more you keep your mouth really tight and sealed, like blowing through a tiny straw, the more you're slowly releasing the air, the more you're engaging your pelvic floor. So as you inhale, exhale, breathe out, zip it up. And you're really gonna feel your transverse abdominis, which is a natural corset of our core, all the way to your spine engaging. Again, inhale, expand. Exhale, zip it up. Well done. Now we're gonna use the Circuit. You can use the Circuit in a lot of ways and forms. So we're gonna start all fours position. So all fours, if you notice, crawling position for babies, they're engaging the core. And for absolute beginners, all fours position is one of the best way to engage your core. Holding the Circuit, you're gonna feel some instability on it, and that's a great tool to feel the imbalance. And when you do that, your core will work harder, but at the same time, not to the point of hurting your diastasis recti or your pelvic floor. So when you're putting pressure on the Circuit, that is a lot of core control already. And want to make sure you engage your upper back all the way to your spine. As you inhale, I'm going to push my belly out. Breathe in. As I breathe out, I'm slowly lifting up from my lower abs to my navel. As I breathe out. And I'm gonna feel more core engagement because I'm against gravity. At the same time, I'm using the Circuit to really challenge my core. Even though isometrics is what we're doing, we're actually really working hard right now. Breathe in. You can see my belly descending, keeping my spine in neutral. I'm not overarching my spine. I'm not posterior pelvic tilting. I'm just keeping that neutral spine position at smaller doses on your low back. As you breathe in, you can see my belly expanding. Exhale, zip it up. Still keeping that message of keeping your mouth small. Keep that reminders as you breathe out. Slowly releasing the air. It's like a tiny tire with a small incision slowly releasing the air. As all at the same time sucking it in and zipping in up motion. Again, inhale. Exhale. And you might feel shakiness now on your core. So you want to make sure you do this 10 repetitions first before progressing to the next level. So after 10 repetitions of deep breath, now we're going to engage our core by doing bear plank. Bear plank is a safe beginner program for postpartum and perimenopausal and menopausal women with pelvic floor issues. As you breathe in, you can see the expansion of my abdominal muscles. As I exhale, again, inhale. Expand your abdominal muscles. Exhale, zip it up. Again, breathe in. Exhale, zip it up. Inhale. Exhale, zip it up and lift off your knees off the mat. A few inches off the mat. Keep that balance and hold it for 5, 4, 3, 2, and 1. As you inhale through your nose, inhale, expand your abdominal muscles. Exhale, zip it up, and then lift. Engage your core. Breathe out. Keep the breath work. You're going to feel some shakiness now on your core. As you breathe in through your nose, expand your abdominal muscles. Exhale, zip it up. Keep that breath work and slowly lift off just a few inches off the mat and breathe out. Inhale as you go down your knees down to the floor. Exhale, breathe out. And then you can slowly extend your arms, rest your shoulders, rest your upper back to a child pose and hold this for 5 deep breaths. Well done. Now we're progressing with single leg extension and gentle, feeling that challenge. As we slowly progress, you can slowly extend one leg at a time. As you breathe in, expand your abdominal muscles. Exhale, zip it up, extend one leg. So you can feel the instability of your core as you gently extend one leg. That's why full planking postpartum is not a good idea. You just want to challenge one leg at a time. Slowly strengthen your core muscles so you don't strain your abdominal muscles if you have diastasis recti, and you're not going to strain your pelvic floor. As you breathe in through your nose, expand your abdominal muscles. Don't forget your belly breath. Exhale, extend one leg and exhale. Inhale as you slowly go back. Exhale. So you're going to feel with the circuit, it's hard to balance, and that's engaging the upper part of your core muscles, which is your upper back, your low back muscles, as well as your thoracic spine. Don't forget those other abdominal muscles, your obliques, as well as your rectus abdominis, they're also part of our core together with your diaphragm. So breath work, pelvic floor, and all those deep spinal muscles, the multifidi, they're all part of our core. Our glutes, our hips. Good. Now slowly rest your arms again and hold it for 5 deep breaths. Inhale and exhale. Feels good on your upper back and your spine at the same time. We are progressing. You can already stop in this position, on this program. You can always resume in 1 to 2 weeks for the next progression. And this is the next progression.
we're gonna do bear plank with leg extension. So as you inhale, exhale, lift off few inches, extend one leg, back to bear plank and all the way down. As you breathe in, expand your belly, exhale, zip it up and lift off your knees, extend the other leg, back center, and then down. Keep your balance. You might feel unstable with the circuit, so that's really a challenge. Breathe in, breathe out, lift, extend, back, down. Even 5 repetitions is a good start. Breathe in, breathe out, lift, extend, back center, and down. We have 3 more to go. As you breathe in through your nose, inhale, exhale, extend, center, down. Breathe in, breathe out, lift off, extend, back, down. And then let's rest our arms again and slowly roll it out. Breathe in and breathe out. Hold it for 5 deep breaths. Another good stretch that I'd like my patients to learn is not just a child pose, but the upper thoracic spine. So this is the lovely puppy pose, keeping your butt sticking out as you slowly push the roller out, the circuit. So if you notice, you're gonna feel a deeper stretch on your upper back and your thoracic spine. As you start breastfeeding your baby, you might feel your upper back a little bit stiff, and this is a great tool to use to stretch your upper back. As you breathe in and breathe out. Well done. Slowly roll up. And now we're gonna do a cool down with a simple cat and camel. In this position, you round your shoulder to an angry cat as you breathe in and breathe out, looking up to the heavens. Exhale. Inhale, round. Exhale up. Breathe in. Breathe out. Inhale, round your shoulder. Exhale, look up. 3 more. Inhale. Exhale. 2 more. Last one, my friends. Breathe in. Breathe out. And that's it. I'm hoping you enjoyed video 1 of our free 6-part signature series on how to strengthen your core safely and effectively using a circuit. On our next video, we're going to use some bands together with our circuit to fully engage our core, upper back, lower body strength safely and effectively if you're postpartum, perimenopausal, menopausal women. Until next video training, always remember, be safe, be well, healthy you. Bye!